Florence Nightingale Museum called nursing for a film project. To celebrate Florence Nightingale, EFA share great stories from all the nurses who follow her. With an introduction and 6 questions, Florence Nightingale Museum make this film project a reflection about nursing. Hi and welcome to Nurses Move. This channel is dedicated to nurses who want to move abroad to live the dream of their life in the place of the planet that they love most. If you're new in this channel and you are curious about move abroad as a nurse, subscribe and hit the bell notification for stay update to the new and latest video. I am Nurse Tina, and today I will walk you through this question that Florence Nightingale Museum created to realize this film project. Intro. How long have you been a nurse, and what area of nursing do you work in? Hi, my name is Dina Paoloni. I am an Italian nurse, and I graduated in Italy in 2003. So I've been already 17 years that I'm a nurse. I moved in UK in 2015, and I always work in critical care setting. But I had a chance to gain experience in community and management once in Italy and in nursing home and palliative care when I came here in UK at the beginning. Move abroad have been very hard for me because after 12 years experience, I have to start everything from scratch because a different nursing approach to the patients and, because the language. So move abroad is not an easy thing to do for a nurse, and this is the reason why I also give my help online to nurses who want to move abroad. I am a critical care nurse at the moment. Let me know in the comment box below if you are a migrant nurse too. If you are not and you are curious about moving abroad and you don't know really where to start, you can check this video where I talking about how to choose the best country to move abroad. First question. In your opinion, how influential has Nightingale been to nursing and or to your work personally? Florence Nightingale was passion-focused, scholar, researcher, organized and aware of the environment person. So I really believe that she's continues to influence and inspire us every day of our work and our art as a nurse. When I was young, I didn't want to become a nurse actually. I want to be a doctor, but for some economic and family reason, I landed in nursing school, and this for me was strange because I was very, very sure that I want to be a doctor, but I fell in love with nursing pretty soon because Florence Nightingale. She inspired me to be a scholar and a researcher. And she teach me, and this is a nice important thing, she teach me that nursing is a honorable and very high profession because the care of human being with intellect, logic, art, kindness, and thoughtfulness, quality that few have altogether. Second question. In her famous book, Notes of Nursing, Florence Nightingale laid out advice and guidance for other nurses. What do you think makes a good nurse? Well, a good nurse is passion-focused, so is up to date with the last and most recent guidance available. So a good nurse is a scholar and a researcher. A good nurse is organized and multitasking, able to manage the little and big emergency that can happen every time So a good nurse knows about hand patients, but also knows about all the patients there are in the unit. A good nurse is also aware of the environment. As Florence Nightingale teaches, a clean and healthy environment helps the natural healing process. So a good nurse protects and respects the environment. For me, a good nurse is also a teamwork believer, always prompt to give help to their colleagues and to the students for the better of the patients. So, of course, a nurse is a positive person that believes in kindness, compassion, and understanding of the others. Well, Florence Nightingale was also a traveler, a migrant. So, I think, and this is my personal point of view as a migrant nurse, a good nurse takes time to make experience elsewhere, to learn to be open-minded and ready to be inspired. Third question. 2020 is the International Year of the Nurse and Midwife. Heroic frontline workers, pillar of the society, are phrases that have been used this year to describe nurses. How do you feel about the representation of nursing during 2020? Well, I felt that the society started to recognize once again our value, is more aware about our abilities and our effort to give care to people. But society should be a little more responsible for itself, trying to collaborate a little bit more in terms of being more diligent and more careful about its behavior and its health. We appreciate the clapping, but we appreciate more the collaboration. Let's say this: the more people are healthy, the less we have to struggle at work for saving life. And this is for the better of all. And you, how do you feel about the representation of nursing during 2020? Let me know, I'm very curious. Fourth question. What has been a poignant moment in your time as a nurse, training nurse? Well, I had several poignant moments in my career as a nurse, but I think that the most poignant moment was when, as a critical care nurse, I saw my father intubated and dying in an intensive care bed. Well, then the nurses who took care of my father did all the best they could, not just for him, because he was their patient, but for me as well, because I was a colleague and so completely aware and conscious about what's going on to my father. And because I was 3 months pregnant, so I was emotionally drained. So I felt a feeling of respect and gratitude for the professionalism and this kindness. And I will never forget those 2 nurses who took care of my father that night. Fifth question. How has your view on nursing changed over your time as a nurse, training nurse? Are there any changes to nursing you would like to see? Well, of course, my view of nursing is changed and it's growth a lot, and especially in the few years when I move in another country, because now I am more open-minded and I am more aware about the capability of nursing professions. So I really would like to see some changing in nursing. I would like to see, for example, in the teamwork between nurses and between nurses and students. I would like to see more positive engagement. Also outside the work, because we don't need necessarily to build friendship relations, but what we need is to build harmony and trust in the team, because in the hard and stress moment, we are more tight and we can better help each other for the better of the patient. I would also like to see more awareness in the environment. As my point of view as a nurse and as a migrant nurse, we should be advocates not just for the patient, but for the whole community and for environment that the community live in. Nurses should educate how to protect and maintain a healthy environment, to live healthy, and to prevent or reduce disease or the spread of infection. Sixth question. This year is Florence Nightingale Bicentenary, 200 years since her birth. What do you think nursing will look like 200 years from now? Well, if the human species start to listen and stop this self-destruction that is insane, I can see nurses work everywhere, from the school, teaching hygiene, self-care, wellness, prevention, to the hospital, in different clinical specialty and setting, and doing research studying, even in the public service, in facility or in commission, managing improvement in the people health, both physical and mental, in the environment health, and in reducing poverty and abuse. And in 200 years, if we will move to another planet for real, nursing will have an important role to build a new colony that will face new and very important challenges. These are my answers as a migrant nurse, and I think that Florence Nightingale Museum did a very great job in make this film project reflection. As a nurse, we should really take some time to reflect to our nursing practice, for understand if we are happy with it or if we need help and advice. In this channel, in fact, we talk about the different topic of nursing, not just nursing abroad. So you are more than welcome to follow us in the social media and to subscribe to this channel. Also, visit our brand new store. We got lots of cool projects for your life as a nurse, in and out the scrub. We have lots of products for your health, your happiness, and your eco-friendly life. Also, have a look to our special branded design with a lot of products and for a unique nurse's outfit. If you liked this video, give me a thumbs up and let me know what you're thinking about. I'm curious about your answer. I can't wait to read them. Let me know in the box below. Don't forget to subscribe, like, and share to your fellow nurses and your friends. And if you want to check Florence Nightingale Museum YouTube channel, I will leave down below in the description their link. I'm pretty sure they will be very happy for your visit. Thank you very much for watching my video, and until the next one, make sure you do your reflection of your nursing practice. So see you next day. Bye. Thank you very much.